Thank you, Rosanna. Our next presenter is Takahiro Hirayama, that will be presenting the experience of Japan. Takahiro, the floor is yours.
Thank you for kind introduction. Good morning, good afternoon, good evening, everyone. I'm Takahiro Hirayama. Thank you for giving me this valuable opportunity today. I'll start my presentation. Next. Here's this outline. First of all, I'd like to talk about history of clinical engineering in Japan. In this section, I'm going to cover 3 points: Clinical Engineering Act, curriculum, and the future of our work. After that, I'd like to talk about tasks of CE. Here, I'm going to introduce various guidelines and a wide range of our tasks. Finally, I'd like to talk about CE healthcare technology management leadership principles. Next. The history of clinical engineering in Japan started when the Clinical Engineering Act was instituted in 1987. Our duty is performing operation, maintenance, and inspection of life support equipment under medical doctor's instruction in clinical fields. There are currently more than 45,000 qualified clinical engineers. Next. In order to register for the national licensing examination, applicants must have graduated from one of the educational programs accredited by Ministry of Health, Labor and Welfare. CE certification programs are offered at universities or colleges. Japanese CE acquire knowledge not only on engineering but also on medical science in the course of education. They are also trained in the operation of life support systems, so they can provide clinical skills in the medical side. After finishing a CE certification programs, applicants are entitled to register for the national licensing examination. Then, after passing the exam, you gain a national certification by the Japanese Ministry of Health, Labor and Welfare. Next. This slide is about the characteristics of CE in Japan and overseas. In the US and Europe, there are separate qualifications for operation of ventilator, cardiopulmonary bypass, hemodialysis, and healthcare technology management. On the other hand, a Japanese CE can do all the work with a single national license. Next. The tasks of CEs in Japan are in accordance with the practice guidelines. The scope of our work is determined by the guidelines. If we don't follow the guidelines, we may violate the law. This is important for providing clinical skills, possibility of harming patients, and protecting ourselves. Next. Traditionally, Japanese CEs have focused on these roles. In Japan, several technical fee based on the national healthcare insurance system are approved as a result of involvement of CEs. I believe this is an evidence that the work of the CEs is being recognized. However, I think this rate is not satisfied yet. In recent years, the number of roles for CEs has been increasing due to the diversification of work. I'd like to introduce some of them. Next. The operating room tasks has expanded to include robotic surgeries and navigation systems and so on. Hyperbaric oxygen therapy, we operate the system and monitor patients. Next. In the catheter room, as shown pictures, We are involved in a wide range of cardiac procedures, so CE is indispensable. Next. Besides the tasks I previously mentioned, we have offered tasks such as home care ventilators and endoscopy. Home care ventilators are receiving a lot of attention because more patients will be provided medical treatment at home in the future. I expect that our opportunities will be expanded. Next is our ICU tasks. Next. I work mainly in an emergency ICU. The ICU is one of the duties that CEs are most widely involved in. Interdisciplinary cooperation is important in order to provide the best possible care to the patient. In our ICU, the patient's condition is shared daily with doctors, nurses, physical therapists, pharmacists, and dietitians, and they work in cooperation with each other. As a result, the kind of collaboration makes each specialty a greater force in team medical care. Next. In blood purification, we prepare for various treatments and perform the tasks as shown on the slide. And we suggest the course of treatment based on the understanding of the patient's condition. Next. Respiratory therapy performs the task as shown on the slide. When we treat a patient with COVID-19, we put on PPE for aerosol-generating procedures while changing the filter or dealing with trouble with other healthcare professions. Next. We are involved in overall management during ECMO. Medical facilities that can perform ECMO are still limited. Furthermore, not all CE can handle ECMO. From the impact of COVID-19, it is found that we need to aim of improving the ECMO training program. Next. In Japan Association for Clinical Engineers, JACE, and Foundation, a federation acted towards the government resulting in new standard addition to the National Healthcare Insurance in 2014. A new standard was added, which is management cost for specified intensive care units. And that means full-time CE must be on duty for 24 hours in hospital. Since then, the number of medical facilities which arrange CE on night shifts has been increased for arranging a 24 hours in hospital CE system. By this new standard, CE were asked to perform a variety of tasks by other units, additional to the intensive care duties. Not only intensive care duties, but also the entire CE tasks have been activated by this new standard. Next. Currently, CE new allow to place needle into only every fistula at the beginning of each hemodialysis treatment. Legislation is being prepared for task sharing to allow CE to take IV medication, remove needle, and so on. Regarding the treatment involving life support equipment by CE, because in recent years, the overwork of doctors has become a problem in Japan. JACE is working with other professionals for sharing tasks. Next. I'd like to talk my experiences of CE-HTM leadership principles. I became a clinical engineer in 2010. I got the position as the very first CE at an acute care hospital, which played a central role in the region. There was no one knew about CE and what to do with CE. Nurses were in charge of checking medical equipment, but not much check wasn't done. After a year, 2 more CEs joined the hospital, and we started sorting out materials and inspecting medical equipment. There was no concept of medical safety measures in that hospital, and it took lot of time to get people to recognize the importance of CE. To keep our team motivated in an environment where there were no seniors, we communicated often with other medical facilities and created our base. We collected the needs of CE in the medical field. In collaboration with physicians and nurses and other healthcare professions, and developed various roles such as ICU, HBOT, operating room, physician assistants, and so on. The role of CE had got recognized and spread for 4 years. We eventually got to 11 members in the CE department. I believe that our ability to provide clinical skills, in addition to medical technology management, was a key factor that made our position approved rapidly. At that time, it was predicted that artificial intelligence and transplant medicine would develop in the future. I strongly thought that we must deepen our skills and knowledge in clinical engineering and make our work more multiple. And I began to feel a sense of urgency that we must keep updating ourselves. So I moved to Okayama University Hospital to build up my skills. I am making the most of that academic environment. I entered a adult graduate school to be able to form evidence regarding CE. I'm conducting clinical and research work. I'd like to pass my work on to my juniors. Next. In conclusion, next. In conclusion, the Japanese CE is the only certification that is approved by the government in the world and can perform a wide range of tasks. JACE and Federation is acted to the government for the revision of Act for CE. We participate in task sharing between physicians and other healthcare professions. CE will be allowed to take IV, so on, by the new Act. It is important to collect and spread our evidence of our work for improvement of our recognition and value in medical practice. Next. That's all. Thank you for attention.
Thank you, Takahiro.